Good morning, folks. This is John Decker, the Director of Community Services at Alta California Regional Center. Today is December 9th of 2022. We've got 46 folks on, and this is Coffee with Community Services. And this is Coffee with Community Services on Santa Day at Alta California Regional Center. So hopefully folks can see my shared screen. This is what's going on downstairs right now. We've got a number of booths set up. We've got some lines that are starting to get a little bit long for pictures with Santa, but folks are having a great time down there. So just wanted to start off. We probably have a number of folks that are down there in that meeting today, rather than, or it's Santa Day, rather than here at Coffee with Community Services. But we're going to do our best to give folks the updates that we have here and answer questions that people have as well. So I see some of our community services staff on, so let me just introduce the folks that we have here this morning. It's still morning. So for community services, I see Adriana, and I see Dee Dee, and Jason, and Shirley, and Gary, and Carly, and Heather. And I see my assistant, Zach, and then we have Michelle McDonald, who is our community services manager, and Isabella, one of our community services specialists as well, and Helen Neary is here too, one of our community services managers, and Jordan Eller is off today. For today, we have a number of things that we're going to be going over. So first off, as you saw when I was sharing my screen earlier, today is Santa Day. Hopefully you can swing by, bring some clients by, lots of fun. It's our first time being back in the building for a while, so again, looks like people are really enjoying themselves down there. I cannot wait. I'm going to go down there in a little bit myself. To talk about our agenda for today, we've got some updates from the department related to the employment grants. So we'll talk about the employment grants briefly. We will talk about upcoming vendor forums for like supported living, for example. We will talk about the social rec grants. We will also talk about some new positions here at the Regional Center as well. And then certainly answering any questions that folks have. I know last week's meeting was very heavy on talking about remote services. We did send out widely to service providers the different directives that came out related to the remote services. And so certainly want to provide opportunities during today's meeting if folks have questions specifically about the remote services, about the Taylor Day services, about the end of alternative services. So first and foremost, I wanted, and we don't have her here in the meeting, but I did want to share that Alta California Regional Center is looking at shifting the way that we work on our authorization for dental services. So we've had a dental committee. Lots of input from our medical doctors and lots of input from our community services specialists as it relates to the guidance to service coordinators and authorizing dental care purchases of service. And we have changed to now is we have brought on Shannon Willoughby, and Shannon is a dental hygienist that is going to be our new dental coordinator at Alta California Regional Center. So she's actually already started. I know Helen met with her briefly because there's going to be kind of a move from more of the review of things via committee of folks and looking at instead more specifically trying to get input from a clinical specialist like Shannon is. And many of you have dealt with long delays in getting things authorized for clients related to dental issues. And so we're hoping that this can speed up the provision of service for our clients. More to come about that. We'll also be talking a little bit about Shannon in our upcoming newsletter that's going to be coming out January 1st. So that is going on there. I wanted to take a moment and again, I don't want to belabor the remote services, TDS, and alternative services stuff more than I have to, but it certainly has been a big area of discussion. And so I'm just going to share my screen real quickly because again, I think most folks are signed up on our mailing list and should have received links to where they can get the information for the regional center directives. But if they haven't done that yet, I'm going to share my screen here. All right. And Andrea Kroom, are you seeing DDS's website? All right. Thumbs up. Perfect. So from the main page, and I always like to show folks how to navigate to different things. So from the main page of DDS's website, you can scroll down and it has directives to regional centers right there, directives to regional centers. And on here, this is where the directives are that we went over during our last meeting. So during our last meeting, first thing we talked about was remote services, day programs and independent living services. So the allowance for remote services. And then we also talked about tailored day services. These are the ones that came out, last week or right before that, the first. And again, a description of tailored day services, and then also the two enclosures that are in here as well. Enclosure A is that program design addendum. Basically, it's not really a program design addendum. Basically, it's an attestation saying that you will deliver tailored day services in the manner that's outlined in California law now. And then enclosure B is the document that goes over the development of the individualized kind of services for clients for tailored day services. And again, we sent these out to folks, but we want to make sure they know where they're at. And then the last one was alternative non-residential services. And again, affirming what's written in the law based off of the trailer bill that was passed for the most recent California budget, which indicated that billing for alternative services will end effective December 31st of this year. So I want to stop sharing my screen because there was a whole lot that we talked about last week as it relates to this. And I know there are some outstanding questions that folks have brought up. So I wanted to see, as it relates to remote services, tailored day services, is there any questions that folks have, service providers specifically, that we need to kind of be aware of and share here in this meeting? So any questions from folks that have come up related to this? What do I do? Count to five? If no one says anything, we just move on. Was that you?
Yeah, I have a question, John. Has there been any clarity on if there's any change in how alternative services billing will occur?
Yeah, so there will be no more billing for alternative services. So all the alternative services authorizations go away at the end of December 31st. One thing that has come up is, well, what happens when if I have to close my day program the second week of January because we have a big COVID surge that happens, like that type of thing? That's one of the questions that's come up, and actually people are dealing with that right now. I think DDSO, we heard about it last week, right? Again, I think that is an area where we're still. I think that is an area where. Whoops, sorry, I had to mute you, Yvonne. I was getting a little static there on the backside. So again, I think that's an area where we don't have the clearest guidance yet from the department. What we know is that, you know, unless there is a state of emergency, there's not a whole lot of ability to bill for absences. And what we've seen is, like with big winter storms or big power outages and things like that, is that the department will put out a directive like, hey, if there's a service provider in Nevada County that was impacted by this, well, then they are allowed to do like retainer billing, you know, during that time frame. But the large delivery of alternative services in essence goes away. So once, you know, January 1 hits, the expectation for service providers is that the services that will be delivered are in line with your approved program design, that are in line with the approved ratio, for example, that you would have for your services. However, there is also that ability to bill for those services that are delivered remotely, which are described as, you know, through telephone or through video. Andrea.
And I wasn't here last week, so I don't know if this was discussed, but are all purchase of services going to just be traditional as of January 1st? Or, I mean, all of our folks are meeting with people, but they're just all going to turn that? We're not going to have a weird in between with no purchase?
We're really hoping for no weird in-betweens with no purchase. We've been telling our service coordinators since August to meet with service providers and to meet with the clients and have these discussions. We know, just recently DDS did put out, in their memo related to the remote services that they're asking our service coordinators to go out and make that contact. Well, we asked our service coordinators back at the end of August to say, hey, by October, we want to start getting these meetings scheduled. So there should not be a huge issue with the change over to the traditional authorizations that existed previously, because again, there will be no alternative authorizations after December 31st. We've lost the ability to pay for that.
Yeah, and we were having those meetings. I know there was just I had a couple of incidences where directors call me and ask about the ending of alt services, because service coordinators saying that they were going to extend the alt service POS through the beginning of next year. So, and they said that no, that's not a thing. So there was there's maybe a little confusion, but that was maybe.
And I will say, to overcome on some of that confusion, we are doing a training next week for our service coordinators, because again, like all of those directives dropped like right before we did Coffee with Community Services. And so we really do have to address them. But though we had a number of service coordinators that were on last week, and certainly a lot of managers as we have now. So, I saw Carol Wilhelm and Rowena and Christina this morning, some of our client services managers that have joined us for the meeting too. So with that, we are doing a training, I think it's on Wednesday of next week, where we're going to be going over the remote services, tailored day services. We certainly want to make sure that the updated information that we provided last week is available for everyone. But what I will say, Andrea, because it was literally 56 minutes of me talking straight about the directives, is that if you want to go back and get that recording, I think it will be very helpful. One thing we found out about the Zoom platform, though, is that the recording is literally just of my head the entire time, instead of like this whole crowd of people. I don't know how to change the settings for that. So it's a whole lot of staring right at me for a whole hour while I talk without taking a breath. Sophia, yes.
Hello. This may have been discussed last week. I didn't attend. My question's in regards to transportation services. So let's say somebody is remote only 3 days a week, and they're participating in a program where they're doing artwork and doing an art project. Is transportation being funded to deliver those materials to that individual?
No.
Okay.
No, we're not. The alternative services are over. And so we are not doing things like delivering packets and things like that.
No artwork or projects, I should say that.
That is, again, I will say, the service providers that are doing remote services, certainly if you guys are interested in going out and delivering things to different people, that's certainly your prerogative to go ahead and do that. But no, we are not going to be authorizing things like remote services, alternative services, packet delivery and stuff like that moving forward.
So it wouldn't be it wouldn't be traditional either.
That is not a traditional transportation service.
Exactly. Okay. All right.
And again, when we talk about traditional, we're all, we are kind of discussing it as, because that when you say traditional versus alternative, like it was really just thinking of how were people vendored. What does their program design say? What is their service code description for what their services should look like? Because all that got jumbled up over the last 2.5 years, where people were doing things. Our transportation providers were basically day programs at that point with the activities that they're doing. But that's not going to be in effect as of January 1. And remote services, again, are really going to have to be, and we've talked about this, really driven by what the client wants. Eric, I saw your hand up, but then it went away, I think. Or maybe I took it down on accident.
Yeah, just one thing on that. I did have it up. I know that DDS is concerned about the transition from alternative services to traditional for transportation providers. If those providers are trying to serve programs that don't allow them to have the similar kind of routing structures that they would have had pre-COVID. So there was a meeting, I don't want to say much more about it, but there was a meeting this week and there's a meeting next week to try to brainstorm if there's any options that could be provided There won't be an extension of alternative services, so please don't think that. But they did at least reach out and ask, can anybody come up with good ideas that would be, or at least share information. I wouldn't say they were asking for good ideas, but they were asking to learn a little bit more about the issues that transportation providers might have if they can't run a normal route and bill traditionally, if people are doing half days and flex schedules and not every day, and everything is changing. So we'll see. I don't want to get anybody's hopes up, but we'll see if they do anything about it. They're aware of the problem.
I think one thing for us to talk about too is for those of you offering things like half days or only ordering partial days, our planning teams are going to ask for full day services if that's what the client wants. So I just need folks to be prepared that you may be losing these clients if you it did not happen as much during alternative services, but with alternative services going away, if you're planning on having very limited program options, be prepared that clients will leave your program and they will go somewhere else and go do a program that offers more opportunities that they are looking for. So that's a natural part of coming out of COVID. And one thing I really don't want folks to, I'm already starting to get emails about it, but kind of thinking of like an ownership in essence of oh, this client's my client and they've been my client for 20 years. Well, they're not your client, they attend your program. And so just something to remember during these times. I saw Jacob shake his head when I said that, because client advocates are very attuned to things like that. And so again, I just want to make clear to folks like that, and I've heard it loudly from our case management staff, so Michelle and the associate directors, that we're going to be looking for program opportunities that meet the client's needs. And at some point, our service providers are going to have to, in many ways recognize that you're going to lose these clients if you can't offer what they're looking for. So questions about that or that statement? Valentino's got a hand up. Yeah. You got to unmute yourself though first. Oh, you're muted. We can't hear you.
Okay,
There you
I'm
go.
sorry. So one of the issues that we've had the last few months is when transportation services have been set up, we're kind of kept out of the loop. And a lot of times these companies aren't contacting the clients or the providers and letting them know that they're picking them up the next day. Not only that, we need to have that information so that we can contact them when they're late or when we're closing down for program. I had an issue when I was making all those calls, and 2 or 3 of these companies weren't answering. Their messages were full, and if I did leave a message, they weren't getting back to me. So is there any way that when transportation services are set up that we can be CC'd in that, or is that something that's not possible?
I think what we would need to do is take a look at that the TSR process, the transportation service request process. There should be, I will say, I have heard these complaints as well. I have heard complaints about people just getting picked up places, or and when they weren't scheduled, or that it was not aligned with, like, the program was offering remote on that day and the client was picked up to be taken to a place where they weren't offering in-person services. So I think it is really important to align that. And so Helen, I think what we need to take a look at is maybe a messaging out to, we certainly, I'm sure, have a number of transportation providers that are on here today, but I'm also guessing that the ones that are on here today and that typically attend these meetings on Friday are not the ones that don't return your phone calls.
Right.
So, that's just kind of my experience.
Sure.
And so, with that being said, if you are running into continued issues like this, you as a, service provider can reach out to your community services specialist and say, like, hey, this is what's going on and I need some specific assistance because of, this is what's happening with this transportation provider. And then on our end, we can get together with the, community services specialist that's, let's say, responsible for the day program. And then we can have that discussion to ensure that there is good communication with that specific transportation provider. And again, I know which transportation provider it is because this always leads to issues. This always leads to, because there's poor communication that goes on in the front end, there's misunderstandings, clients getting left places and everything else. So I know that is unfortunately a little bit of a trend with some of ours, but not something that not something that is, I mean, it's not, how should I say it? It's not like a very uncommon thing to occur. So let's talk about the process. If there is these issues, I empower you to reach out to your community services specialists specifically, and then we can work with Helen and her team that work with the transportation providers.
Okay, thank you.
You're welcome. Sophia.
Sorry, Megan. I don't directly work with care homes. I have a couple of clients that I'm placing care homes, so I have them. But my question is, as far as the extra COVID funding for care homes, I don't know the status of that. And also, how does this work with remote services with care homes? If the clients choose to do remote services, is there that special funding?
So,
Special funding.
so we can certainly talk about that a little bit. One thing, and I will share with Sophia. So we don't typically do a lot of questions from service coordinators.
Oh, okay, sorry.
Because it's a service provider meeting, and we're sharing information with them. So we want to be kind of prepared to share the things that we have a lot of information about. But we can certainly have that discussion about residential. We don't typically have a ton of residential providers that are on here, but what we recognize is that if there are remote services that are going to be going on, it is going to continue to have an impact on residential service providers. It will continue to have an impact on SLS providers, continue to have an impact on the regular residential care home providers, and more than anything else, it's going to have an impact on family supports, because most of the people that are served don't live in care homes. They don't live in SLS. They live with their families. And so you continuing to offer remote services, or maybe only offering remote services in some cases, is going to be a burden on those individuals that are still required, to be at home and maybe provide supports for folks. So for people that are under the residential care, I feel like we talked about this a little bit during our meeting yesterday or day before, but we certainly recognize, and we've been talking about this, that the hope was there would be less and less remote services that were being offered towards now, and that we would have a buildup of more in-person opportunities for people. And then at that same time, as the increase occurs for the in-person services, that the supplemental staffing that the regional centers have been paying for COVID, basically, would kind of go down. What we understand is that that's not going to go away completely. And we are really going to be looking closely at those purchases that are in place. But right now, again, we're just moving into a big transition starting January 1. And so the main thing is just making sure that the clients are really getting the services that they are wanting, and that what is being offered to them is really aligned to what their needs are. And so again, it's Johnny, you mentioned it last week when Johnny Zhang was on, our Associate Client Services Director, that again, it really has to be client driven. Like we really, we did retainer billing for a long time. We did alternative services for a long time, but we're at a point now where we need to kind of get back to providing these opportunities that we provided previously. Carol Botello, hand up. Yes, please.
Just wondering, I agree 100% with what you're saying, but also recognizing that providers are still in a huge staffing crisis issue. And that, while we're saying, well, clients may, if they choose not to be with your program, they're going to go to another program. Like, is that reality? Like, are we telling clients they have that option, but that's not really an right? I'm just wondering where we are at with that right now.
Yeah, I think we're telling them it's an
knowing.
option, and we want to encourage them to take that option. Like if there's other opportunities that are out there that they feel are going to better meet their needs after being, dealing with COVID over the last 2.5 years, and then it'll be up to that client at that, just like at any time, a client can determine whether or not.
Sure, but is there actually an option? Is what I'm saying.
Yeah.
Are there providers that are fully staffed, that have openings, that are, and just do we have a sense of that, like where people are at moving into January? Do providers have openings, opportunity? Are people fully staffed? Do we have that? Do we know?
Well, I will say first, we have 72 folks on today. So is there a service provider here that wants to weigh in on that? I certainly have started to hear from some service providers that they are able to get, a few more interviews and people coming in. But at the end of the day, like those are brand new DSPs. Those are like brand new staff, right? Working with folks, even if you are going to do that. So for Shirley or for Jason or other folks that are working with our day programs, are we hearing about day program availability from folks?
Hi, John.
Oh, I see Gary on there too. Yeah. Go ahead,
Yes,
Shirley.
yes, we are. And I'm actually hearing both. As Carol mentioned, we have some new programs coming online. We have brand new programs coming online, so that will make a little bit of difference. Some people have been able to retain your staff all along, as you mentioned. Others are still struggling. And so I'm hearing a lot of and seeing a lot of addendums that are talking about hybrid services still. So I think it's a real mixed bag. I think that there will be some new choices. I know there will be some new choices because we're vendoring them now. And but I don't think everybody's whole yet. That's my sense of what's happening.
Yeah, and I'll
Go ahead, Jason. Yes, please.
Oh yeah, I'll second that too. It is a mixed bag right now. I mean, we've got some that, during the pandemic, they've been able to operate traditionally the whole time, but then we've got others that, have been very concerned and, wanting to see if there can be a ratio waiver. So it all depends really.
I'll just add too that I think that there are certain areas that have been hit harder than others. It's not exactly evenly distributed amongst our whole, area that we serve. So that adds another layer.
And I think it's going to fluctuate too, right? Because like your situation that you're in January may not be the situation you're in February and March. But again, what the point per se of all of this is to ensure that we're starting to get these things like we're planning on offering remote services 3 days a week, like only in the morning and stuff like that. Just understanding that if you put that out as a service provider, that might not be what the client is interested in, and you should have an expectation that the service coordinator might be looking for other types of opportunities for different types of supports. Again, I will say, Carol too, and I'll get to Eric, is that we did do our hiring challenges survey, and unfortunately, we only had about a third of the number of people that filled it out this year than filled it out last year, but still that's, I think, 65 different folks that filled out the survey. And so we will be looking at sharing that data with you all. I think we might be able to have it done by next Friday and be able to share that. And also a comparison between last year and this year as it relates to the hiring challenges. And then again, part of the reason why we do those is so that we can communicate what the challenges are that people are facing in their hiring across different types of vendors too, not just obviously day program vendors, but last time on the residential side, there was huge challenges on the residential side last year with hiring as well. Eric.
Yeah, I just wanted to, I guess, just chime in. Good to hear that there's some positive news out there. I mean, we're hiring too. We've hired more folks this month than last month. But I will say, I think the reality is that choice is more restricted now than it was before COVID, right? Like, I just want to make sure we're acknowledging like choice right now is sort of dependent on that person finding a program. And I would say the capacity of the system right now is very low, but it will be, number one, it will be increasing. And I do think it's important. And what I'm hearing from you, John, which I would agree with, is that as the system rebuilds, it has to be built on that foundation of client choice. So even if those choices aren't available, we should all be rebuilding our programs in such a way that we understand that's the principle. But I would agree, the choice right now is going to be fairly limited, but it is expanding and it should be based on that. Even if choices aren't that available right now, it should be built on that principle.
And that's the reality of it, right? Like that we know that there's people that are having these hiring challenges, but I mentioned it, I don't know how many times last week when we talked about it, and I will be mentioning it again when we do our training for the service coordinators next week as well, is to just really empower people to ask that question. Like, is this meeting your needs? Is this what you are interested in doing? And then again, our community services specialists have been pretty in tune with their service providers to know kind of what's available out there. We certainly had an opportunity to bring in service providers on the day program side to come in and do a vendor fair a couple weeks ago, 3 weeks ago or so, or when I was out. And so again, I'm hoping that the communication is going on and people are explaining what the challenges are as it relates to some of the hiring, so that people know what they're looking for. Yeah, I like how you're saying retooling too. I like that word, Carol. I'm looking over at the chat there because that's a reality, right? People are now re-looking at it. That's people have in meetings yesterday. I was at DDS in some DDS meetings, and people were talking about just the challenges of getting back into this idea of not having the flexibility to do some of the things that were available during alternative services, and then the challenges about with TDS and remote services of being able to have the staff to be able to provide those one-to-one supports. Like I will just say that's a lot of the feedback that I received was that, it's not really service provider relief when the ratios, are required to be the exact same as they were previously. All right. Well, we almost got another half an hour out of remote services and tailored day services. Any other questions related? I don't know. And again, we do have Jacob Miller here, who's one of our client advocates. Jacob, do you have any feedback about, kind of what we're saying here about the client-focused nature of these meetings that are kind of ongoing?
Just directly right now as things are set to change. Sorry about the beeping, but I think it is, at least the team that I'm a part of, I think it's just all about continuing to keep the door open as far as communication, because as Eric cited, things are very different from the way they used to be. And for a lot of our clients, they just care about the result. They don't necessarily aren't concerned the most, at least the ones that I've dealt with about these issues. They just want their answers and the result to be provided. But if we can educate them on kind of where the process stands and what it looks like, I think that would really help educate so they have proper expectations. That seems to be something that is really important for our team when communicating these things, because people want their resources, but are they being provided accurate information as far as how long it'll take? What does it now look like? So just providing proper expectations, I think, is something that our clients are really wanting.
All right. Oh, someone said I missed last week. Let's see. Oh, there was a question about HCBS. We're going to get into a little update on HCBS as well. And we do have a HCBS specialist that's going to be coming on board, but also Michelle's got some more updates on that. And we'll get to that in just a little bit. Michelle's ready to go and give updates right now. We'll wait just a minute here. I do have another thing up. Helen, we got an extension this week on, let's see if I can share my screen with folks. All right. So, and I think I can maximize this so folks can see it okay. So this came out as well on December 2nd, and it is updates related to the extension of options for pre-enrollment transition supports for SDP. And option A is going to remain an option through June 30th of 2023. And option B, the one that was described, is going to remain an available option and become the sole option in July 1 of 2023. So I think, Helen, the only thing that occurred was a rollback of these dates for the implementation of the SDP for the source code 099 self-directed supports. Anything else about this that we want to share?
Sorry. Yeah, we are continuing to look for providers that are interested in SDS, either FMS, SDS, or just general self-directed services providers. So yeah, we're continuing, and the vendorization packet, the DDS is continuing to work on that. I don't have any other updates, John. Just that.
I have a feeling that very shortly, maybe in the next couple of years, that's very shortly, I guess, is that we're going to have a standardized vendorization packet across regional centers. I think there's been so much, and maybe this is the good first step to, I know Carol's happy. Everyone should be happy. But maybe this is the first step towards, we're trying to get rid of some of these, what they call the geographic disparities between regional centers, where you can go to one regional center and get, this vendorization opportunity, and it goes through, relatively easy. Go to another regional center and they're asking for things that are really not necessarily required by regulations or statute, and certainly can delay the process for vendorization. And so more and more I keep hearing about it, and I think this development of the standardized vendorization packet for self-determination, I'm hoping is going to be able to serve as a model for us, moving forward. Again, if there's any way we can make it easier for people to get into our system and become providers, I certainly want to do that. Carol, hand up. Yes, please.
Just had a question. Helen said something about self-directed services, and I was confused. Is that something new too, or just the self-determination?
So the self-directed services are what was outlined in the so first in the chat, I have put a copy of the directive from the department. In the directive from the department, there is a link to the previous directive that came out on July 28th of 2022 that describes the self-directed supports and being able to use that through the vendorization for 099. And so I would just recommend going through that previous directive and kind of taking a look at it that way, and then reach out. Again, this is all new for us. We're kind of just getting it figured out on our end at the regional center, but I think that's kind of the best way, right, Helen, to understand it, is to take a look at, and I'm going to pull the directive back up again real quick. So if you go to that, and then they will have the previous guidance. And so the previous guidance outlined the self-directed activities, and it also outlined the, what option A and option B was. But as they said, they basically pushed back the allowance for the time frame for implementation on these. We can spend a little bit more time talking about this because it is, I don't remember the extent to which we really touched on it a lot the first time around when it came out. So maybe we'll save that one for an upcoming meeting. Helen, maybe next week we can take a look a little bit more about the 099s and spend some time talking about the new opportunities for vendorization there.
Yeah, John, there is an RFP.
Oh, you're right.
Yeah,
Yes.
on our website. It outlines what self-directed services is and the 099. I mean, it's new for us. And so me and my staff are also researching it, kind of reading, understanding the 099 and what it's supposed to do. But we do have an RFP online, and it has, it outlines what the general SDS is supposed to do, and what the duties and responsibilities of the FMS SDS. Yeah.
So I just put it in the chat. Oh, wait, there we go. Now I just put it in the chat, and then I'm going to share my screen real quickly. And so you can see sorry, Helen, I forgot to mention that we had this put on here. So you can see under our request for proposals, and then this outlines the information that Helen just shared. And then also, Helen, real quickly, can we have you give an update on the community integration grant opportunities?
Yes, the social recreation grant is due December 15th. I have had about 3 organizations that reach out to me. I do want to point out that if you are looking at serving, for example, Valley Mountain Regional Center, Far Northern Regional Center, so you can have a kind of like a coordinated grant proposal, and then you can choose a lead regional center. But it's not going to be applicable to an applicant from Southern California and want Alta to be the lead. It's just too far out and the activities are different. But if you have a program wherein you would want to serve Valley Mountain, Far Northern, and Alta, or Valley Mountain, Far Northern, CVRC, that can probably be done. Yeah, but I think the idea of the lead regional center is applicable, especially for the 7 regional centers in Southern California. So again, integrated and inclusive program, and as much as possible, target the culturally and linguistically diverse communities. And that's December 15th. That's all I have, John.
Excellent, thank you. So for Michelle, let's talk about HCBS first. So kind of what's going on with HCBS, what's been going on related to HCBS. And then we did have our HCBS evaluators meeting. I don't think that there was a ton that came out of that meeting, the ARCA meeting, but you know, if you can kind of explain kind of what some of our activities are and how we're doing. And we also have a new staff that we'll be introducing too.
Yeah, good morning, everyone. So Alicia Gauchi, she is starting on the 19th. She will be our new HCBS specialist. And you guys might have been in contact with her already. She's kind of been immersed in the process for the last few weeks. And she has been to some workshops. So we are continuing to hold workshops. We are having at least 2 a month. And the way we're working those is that if you are interested in the workshop, it's a 1-to-1 support. We have a morning cohort and then an afternoon cohort, excuse me. It's usually about an hour and a half. And so if you're interested in attending those, go ahead and email the HCBS inbox, which is hcbs@altaregional.org. I'll put that in the chat. A lot of things that we're finding. So the December 5th deadline that DDS gave us, you know, has obviously come and gone. And that is to submit all of your plans and your documentations for review. We have a lot of providers that have submitted documentation, but we're finding when we go back into the DDS spreadsheet, there's notes on there from DDS and the reviewers with additional documentation that's needed. Sometimes they're really good about providing that information and specifically what it is. And sometimes as a team, you have to work with your specialist to review those documents and really see where those gaps are. So we recommend that if you do have questions, even if you did submit some documentation, reach out to us, give us your vendor number and your name, the vendor name, and we're more than happy. Christy Schaefer has been assisting as well. So we're more than happy to look into that with you. We've had a lot of good feedback on the workshops. A lot of our providers have been able to work with our specialists and get those done that day so we can market compliant. And we're compiling a list. And so moving forward, we'll let you know if you're on that, you know, if you're the next one up, we'll email you with a confirmation email, who your specialist is and the time frame for those. And I see Carol just posted about the workshops. So we're not posting the dates until they're available, just because it is a 1-to-1 service and there's only 25 spots available, just because of the limited, you know, amount of specialists and their time. So, you know, you can always reach out to me and I can put you on that list, but we have not posted any of the specific dates at this time because we just want to make sure that it is, you know, 1-to-1 and we don't have a lot of people showing up just that we cannot support.
We're directly inviting people to come, correct? That's
Yes.
the way it works. Yeah.
Yes.
So it's
correct.
not like a general, like open, come, drop in HCBS workshop. Rather it is, hey, we still need this from you all. Please come in. Let's get it knocked out in person in our conference room. And I will just tell you, every provider that I talked to really appreciated our specialists taking the time to go over it with them in person and to get it just done and off their plate. And certainly I appreciate the idea of doing this because it was something that came out while I was gone out of the country, that we were going to start having these meetings and doing that. And again, hopefully we're just winnowing that list down smaller and smaller and smaller. And again, I think one thing we did hear yesterday, which is not a big surprise as it relates to HCBS, is that, you know, what they're really looking at target goal wise for, the beginning of next year, was it March of next year, is not necessarily that every single vendor of the regional centers are compliance, but that there is a plan to get yourselves in compliance or to keep yourselves in compliance. Again, people have in the past have kind of looked at HCBS as very much of a kind of a you either are or aren't, but let's take Carol Watilla's program, for example, and choose that one. Like, you, based on the individuals that you are serving, you may end up in a situation where you have to kind of reassess whether or not you are providing the services in an HCBS manner because of just the individuals that come into the program and what their needs are. And so it's having the ability to be able to deliver the program and still stay within kind of the guardrails of HCBS. But whether it's a new person that comes into a care home or a new person that's working with the SLS agency, like, client needs are going to dictate some of the activities that you're going to have to do as, business owners or managers to ensure that you remain in that HCBS compliance. So again, we're doing everything that we can do on our end. Our numbers look pretty good compared to the others statewide, because of course DDS compares all the regional centers against each other on how many percentage of people are done with their their remediation plans, etc. So anyways, thank you very much for that, Michelle. Michelle, we have an update about SLS too. We wanted to talk a little bit briefly. So I know about a month ago, maybe a few days before that, I met with a number of SLS providers related to concerns about their billing methodologies. So what I did a subsequent meeting with Michelle Ramirez and listened to a number of questions that were brought up by supported living providers. And I know we had a bunch on last week, so hopefully we still have a bunch on this week as well. But come January, there will be no changes to the billing methodology, meaning that if you have a rate that is developed that looks a certain way, it is not going to be, for example, if you have a all-encompassing rate, you are not going to be forced to change your billing methodology in January into separate purchases, for example. There was service providers that were very concerned because I guess there was a rumor or something that got brought up that as of January, we were going to be looking at standardizing it so that everyone bills the exact same way. That is not the case. That is not something that, right now, we have no indication from the Department of Developmental Services when they are going to look at making everyone bill the same way, for example, like for supported living services or for some other types of service codes. What we do have is guidance from the department that says they will let folks know in advance and will engage stakeholders prior to them making sure that they standardize it across the boards. So that's one issue that got brought up that I want to kind of dispel, is that come January, you will still be able to bill the same way that you were billing. And if you received a rate increase back from April, then in January, you will receive that same amount of rate increase, basically. So if your rate went up $3 and something like that, then it's going to go up another $3 come January. And you'll see that when you do your billing at the beginning of February. And we are automatically updating all of the rate tables to indicate what the new rates are for service providers. The other thing to touch on is that there is concern about this, right? There's concern that the way I would not more than a handful of SLS providers, that when the rate methodologies change and it all has to be aligned so everyone bills the same way, that they're going to actually look at losing money possibly because of the new way that it is going to be calculated. So if that were to occur, and let's just throw some dates out. So let's say that in 2024, the department says we have to align everyone so that they bill the same way. And again, we still don't know what date that's going to be. You have until 2026 as a service provider for a hold harmless phase. So you would still be able to bill for whatever your amount is through 2026 if, for example, there was a change in rate methodology that might impact you negatively as a service provider. And so I guess I'm sorry that got kind of blown up a little bit of confusion, that people thought that beginning in January, they were going to start seeing kind of less coming in because of a change in billing methodologies. With that being said, we do want to go over some of these things a little bit more in depth with service providers, and we certainly know that some service providers have already taken an opportunity to meet with Iqbal and folks in our accounting staff to walk through what their kind of their unbundled rates look like and some of those opportunities. So Michelle, we do have a SLS vendor forum scheduled for when? Oh, you're muted, Michelle.
Give me 1 second, I'll pull it up. It is scheduled in January.
All right. So again, we are planning on doing another meeting in January with our SLS providers. We are going to put the information I just got done talking to you about. We're going to put it out in writing today. It's been written up for a little while, but we're gonna send it out today and make sure that we also invite folks to come back for the SLS vendor forum as well. But this crosses all of your service codes. So for each of you service providers, so let's say you're a transportation provider and you have vehicle service hours, and you know that the rate study says that the department only wants rates to be set up on a kind of like a per trip rate type of thing. We do not know when the department is going to decide to make everyone bill in essence the same way. We don't know, and we assume that there's going to be opportunities for them to meet, kind of like with that group that Eric talked about earlier, the group of transportation, folks that has kind of been meeting very intermittently since alternative services started. Eric, I see your hand come up, so go ahead.
Sorry, I had to miss the first half. I had somebody need something. What I'll say is that group met to talk about two things. And this is not public, so I can't get any information about it, but I feel comfortable sharing that it was.
If you're watching this on YouTube right now, turn it off, please.
It was, we discussed rate study calculations for those that have been concerned about the rate study rate. And we discussed the transition from COVID. It was made very clear, those rates that are in the rate study are so low, there will be no transportation services if they adopted those rates. I was able to present my analysis as to why, and I sent that out to them after the meeting. We went over that and it was received favorably about some opportunities to amend that. I also made it very clear, because there's two different things. One, the concern about what's going to happen in the next 60 days, which is not really a rate study issue. And the other one is the rate study. But I did tell them, because there was a comment, very well meaning, well, if we work on the rate study, that's not going to help us in the next 3 months, but we do want to do that. And I did say, you know what, I don't know, maybe in a public announcement regarding budgets in January, some acknowledgement that you're going to fix this, that it's on your radar, might give people hope to, I don't know, get through the next couple of months if things aren't perfect. So I would not discount that. So I have made that, I'm talking about the governor's budget that gets released in January. So we did make that comment, and there are recommendations to them, and there's follow-up meetings. I don't know if it'll go anywhere. I guess I just want folks to know that those that have reached out to me with those concerns, we did incorporate that, and we are asking them, and there's some willingness there. Don't hold your breath for anything right now. Everything is slow on that department, and but we are meeting about specifically the transportation rate study rate methodology, the per trip rate, what went wrong with it, why it works, why it doesn't work, how to fix it, and the timeline. That's probably all I'll say publicly, unless there's something.
Excellent. So thank you very much for that. And again, that is a huge area of concern for us, that the transportation rates are so below what we feel is needed, especially for our huge catchment area that we have. And so any continued advocacy in that end, we certainly want to support it. Again, we need all the rates to be able to be working and functional for you all, and feel like we need all the rates to be able to keep up with the increased costs that you guys are going to be seeing as well. Michelle's put the information about the vendor forum for SLS in there. Carly, real quickly, I don't think we've shared the good news, but the employment grants have come back, and we know who's been awarded employment. Look, Carol Wattillo smiling. So we've got the employment grants, and we found out who's been awarded. So I'm going to share my screen real quickly. at DDS's website, and I don't think that they have indicated the amount, but these are the preliminary awardees. And so we have, and you can search them. Some of them are big group projects that have a lot of different regional centers that are attached to them. But I want to, there was one that so Progressive Employment Concepts has one. And let's see, who else do we have for Alta here? We have Sierra College. That's the one that Carly worked really hard with Lou Vismara to put together. And we've got UC Davis as well. And Zavicon LLC. Zavicon, I think I'm saying that correctly. And so again, a bunch of these ones that have been approved that are looking at serving Alta folks. So once we get a little bit more information about these, like for example, how much they were funded for, because I don't know that every one of them was funded at the requested amount. But we have Carol here. Carol, could you tell us real quickly what yours is about?
Sure. Well, we have to go back, and we were not awarded the full amount that we asked for. So we have to go back and look at what are the deliverables of the project that we're not going to be able to do based on that. But the main one is that we'll be creating and submitting a curriculum to ACRE to be certified to provide customized employment training through ACRE. And then the other piece of it was testing that curriculum by providing that training and assisting people in finding employment based on those people being trained. But we, like I said, we'll have to see which pieces we can't accomplish based on the change in amount. But yeah, we're very excited.
Yeah, again, congratulations. And I know it's a lot of work to put these proposals together. Poor Carly did most of the data entry, I think, for our proposal that we partnered with Sierra College on. And so, again, I'm very pleased. I think I'll be able to get it in the newsletter for January, but we'll be talking about the partnership with Sierra College. We have a meeting next week with the president of Sierra College and the executive staff over there to talk about how we're going to be partnering together to really help identify individuals and get them into a path of getting onto junior college and onto competitive integrative employment from there. And so I will tell you, and again, it helps having Lou Vismara being involved with it, but I have never seen this much enthusiasm from a partner. The Sierra College is at their executive level. Every one of them is so excited about working on this project with the regional center. So we'll be looking forward to meeting with them next week, and we'll certainly share more with that. We are just calendar wise, I think we've got one more coffee with community services before the end of the calendar year. Let me verify that. So yes, so we will do coffee with community services on the 16th. Probably have a bunch of updates for that. And then we will be returning back on January 6th. So we're closed on the 23rd and the 30th, and we'll be returning at that time. So I hope some of you get an opportunity maybe to swing by Santa Day. I've been looking out my window and I just see lines of people coming into our building. So I know it's crowded downstairs. I hope everyone has a great rest of their day. Please reach out to your community services specialist with questions that you might have that came out from this meeting, and we'll look forward to talking with everyone next week. Take care. Thank you very much, folks.